Dr. Jesse Willingham with Brighter Outlook Vision wants you to look at your vision through different lens. Today, I talk one-on-one with the doctor about what he's seeing with his patients when it comes to the eye for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Dr. Jesse Willingham, welcome to Quintin's Close-Ups.
All right, thank you very much.
You are an optometric physician with Brighter Outlook Vision, and I know someone from your office called me to contact me about interviewing you about obviously talking about vision. So tell me, what's new, what's now with Brighter Outlook Vision?
Yes, yeah, so we're trying to just get the word out because while what we do has been done for a while, so there's still a lot of people that don't quite know about it. So Brighter Outlook Vision, I'm an optometric physician, but we're actually a specialty practice. So your typical optometrist you see for your annual eye exams, you're often prescribed glasses or contact lenses to make sure your eyes are healthy. We work with those optometrists for patients who sometimes have vision problems that glasses or contact lenses don't help. So a lot of patients, especially children, have reading problems or attention problems that actually stem from a vision issue. And so we help those patients alongside their standard primary optometrists.
What are today's vision issues?
Yeah, so we have more vision issues than ever thanks to the modern world and the computers that we're working on right now. So truthfully, our eyes work best when we're looking in the distance. Our eyes get to relax and they're more passive with that. The more we look up close, the more energy our eyes have to expend. And some children, really about 20% of people, don't self-develop enough efficiency with those eye movements to activate those eyes, keep them aligned and in focus. And for some kids, it's even kind of painful to do that all day long. So you get things like attention problems because it really is just too hard to keep the eyes aligned on the task at hand.
Wow. So how many of those patients are actually coming into your office for that?
So I would estimate that of probably the 20% of people that have these kinds of issues, maybe only 1 to 2% get identified. Oftentimes because they pass vision screeners because they can still see 20/20 because glasses aren't the issue.
Yeah. So what are the issues today?
So kids who really aren't really picking up reading, who avoid reading because they say it's just too hard, it's usually physically too hard. So any kid who says it's going in and out of focus, or they're especially complaining about headaches from all the computer work they're doing, and because it's harder for our eyes to be efficient on a computer than it is for actual print text, kids who say the computer is blurry, the computer is hurting their eyes, those are the big symptoms. And again, they may get an eye exam, and that typical eye exam will say everything looks normal. But when we do a little bit more looking into how they can actually coordinate those eyes, those special tests, we find these issues.
What is the biggest difference about eye exams from when we were growing up to right now?
Yeah, so the eye exams today do involve a lot more technology generally, so we have really made a lot of advancements in looking at eye health. We can take really great photographs, we can get microscopic images, but again, that's the health of the eye, and most of those issues happen when we're much, much older. The kinds of tests that we need to do for children, most advancements really just come into how good are we at screening these things. So more recent studies, because these children tend to have more symptoms than they do signs, look at just symptom questionnaires that can really easily identify it. There's other technologies that advance too. For instance, a lot of what I work on isn't just develop things where kids don't learn to use their eyes well enough. Some people acquire these issues after a concussion. So there's electronic sideline tests that we're using for concussions too. That's a more recent development to try to track, okay, if you just got hit in the head, can you now move your eyes, or has that been changed? Has that been affected?
What is the state of eye health?
The state of eye health is probably better than it's ever been, just because, especially in the Charleston area, we have a lot of access to eye care. One thing that should be noted, though, is probably one of the biggest growing concerns in eye health is the increase in nearsightedness. So we think about nearsightedness as just, you can see fine up close, but everything far away is blurry. You've got to squint or you've got to put on glasses to make it clear. But more and more children are becoming nearsighted because of all the indoor time, because of all the screen work that we have to do. And as we get more nearsighted, so if a prescription gets too high, that comes with health consequences later on because it kind of deteriorates the eye as we get those higher and higher prescriptions. So even though the glasses and contact lenses might make you see better, there are long-term health consequences if that prescription goes higher and higher and higher. And there are things we can do at our our offices to apply the latest technology with special contact lens and medications to slow down that process and maintain lifelong eye health.
Mm. What is the latest technology that is beneficial to your patients and your office?
In terms of what we just said for myopia control, the latest technology is in contact lenses. So there are really specially designed contact lenses that really can slow down that eye growth by changing how light interacts with our eyes. And that's pretty passive. But we also apply technology to how we're training patients to use their eyes more efficiently. My favorite thing is I actually have a Microsoft augmented reality headset, the HoloLens.
Yes.
And so for patients who don't have good binocular vision, they can't translate binocular vision to the real world. This creates a virtual world where we can make the real world meet them where they're at and slowly fine tune that to push their binocular vision into the real world.
Wow. What is that process when it comes to eye growth?
When it comes to eye growth, one thing I really like to tell people is that while our eyes grow and they come out fully formed when we're born, vision is something we learn after we're born. That first 9 months in mom's tummy is all in the dark. And so while our eyes are growing, they're not developing. And we don't start learning to see until after we're born. So in your first 6 months, there are some screeners that happen to make sure eyes are growing and developing normally. They're most at risk if you were born premature, but we've got really good at handling those things. In the next 6 months, it's great to get an evaluation with an optometrist. And there's actually a program called Infant C, sponsored by the American Optometry Association. And so if you find an Infant C provider, I'm an Infant C provider, and there are lots of others in the Charleston area. From that 6 months to 12-month mark, you can get your first eye exam absolutely free. They don't bill your insurance. It's just a public health initiative to make sure we can find the most concerning developmental problems in those early stages as quick as possible.
What are those developments right now from that age on?
Yeah, so from that age, the biggest things that we're looking for are things that are risks for amblyopia and strabismus, and that's a lazy eye. That's not developing binocular vision.
Right.
And also really concerning things like retinoblastoma. So that's a cancer of the eyes. It's one of the more common pediatric ones, but it is still very rare in itself. But getting that early eye screening can catch it before it's too late.
Wow. Universally speaking, Doc, when it comes to eye issues, which demographic is the most affected right now today?
Right? I think the most affected demographic truly are our most vulnerable, our youngest and our oldest patients. So eyes kind of have a lifespan just like humans, and the older you get, the more stress they go under, just like anything else. So as you get older, it's really important to have those annual eye exams to look for conditions like glaucoma, to look for conditions like macular degeneration, because there are medical interventions to help reduce the effects of those, all right? But for kids, what we really want to do is look at, are the demands of our environment negatively affecting the way their eyes are developing? So it's actually really important for kids to get an average of about 2 hours of outdoor time a day. And you wouldn't believe how many kids are not getting even close to that. And for me, for my youngest patients, I recommend if they get any screen time or tablet time, it'd be limited to 30 minutes a day. And we can do more as we get older, and that's outside of school. But for our youngest patients, babies, toddlers, they probably shouldn't have any tablet time whatsoever, because that doesn't really encourage real natural growth that interacts with the real natural environment, because it's totally two-dimensional. So you need 3D toys that you can interact with, like visual, motor, getting those systems integrated to develop really naturally and develop good, robust, healthy eyes.
And Doc, I'm very guilty of this, but I'm guilty of using this phone almost, I don't know, maybe 18 hours out of 24 hours of the day.
I'm right there with you.
Thank God I have 20/20 vision at 39. But what are today's demands, and how is that going to help? How is that meeting with the growth of your actual eyes?
Yeah. So luckily, using the up close work isn't going to happen. It's not going to result in that really big eye growth and increase in prescriptions as you're older, because it's the combination of that environment and all of like the growth hormone we have as a kid that really makes that skyrocket. As an adult, though, as a kid, you have the risk of the growing prescriptions with the long-term eye health consequences. As an adult, you just have the consequences of eye strain and dry eye. And dry eye is really a chronic condition. So it's almost like you can be giving yourself arthritis on the front of your eye. That leads to inflammation from all that extra screen time use. So I really recommend a couple of things just in addition to getting that annual eye health check exam. The 20-20-20 rule is a great rule of thumb. Every 20 minutes up close, give yourself 20 seconds, look 20 feet away. Right. My second rule is all about distance. So you don't want to be holding things too close because that's more strain on your eyes too. So if you just look at the distance from your knuckle to your elbow, that's about how far away. That's something you should be holding up close. What's really great is Apple actually has native in their products something in the health settings in their app. So if you look at the screen and display settings, where it will turn off the screen and give you a notification if you're holding it closer than 12 inches. So it kind of breaks those bad habits. I don't think Android has that in their software, but they have apps that you can download.
Ah, that is very amazing. So, Doc, as we sit here right now, I want to ask you this because obviously the world has changed since COVID.
Yes.
How has our eye seeing changed because of COVID?
Well, we're still looking for research, but all of the sort of anecdotal and observational data from doctors looking is that we're seeing a huge spike in kids needing glasses and kids with kind of eye developmental issues with tracking and things like that, because they've been really kind of secluded indoors and their school being virtual really limited their experience. And we learn through experience, right? So it's that dynamicness, the novelty of moving classrooms, looking around a big open room versus being just stuck straight ahead on a computer up close, that really limits our eye development and triggers them to adapt to that. So if all your eyes need to do is look right here and look really close, becoming nearsighted makes that easier, but it has consequences. You don't see as well far away. The eye grows out of control.
Wow. What else are you in your office keeping a trend on when it comes to eyesight, eye growth, and
So
eye
our
issues?
biggest thing that we're trying to look at is we want to look at eye-related learning problems. So is your vision getting in the way of learning, reading, things like that? Because there are other things that can, but vision's often an overlooked part. We want to look, are your eyes developing normally, or do they have what's called degenerative myopia? So is it really progressing to a stronger prescription? That's our number 2. And our big third thing is our brain injury related patients, because often vision is overlooked in that. So about 80% of the cortex, the upper brain, is connected to visual processes. So it's almost impossible to have some sort of head injury or brain injury where that vision is not affected. So rehabilitation is often indicated for those patients, but they don't have access to it.
Wow. What is something that kids don't have access to when it comes to their eyes that they should have access to?
Oftentimes it's just screening. Most kids do have some sort of vision plan, whether they're on a government plan or a private health plan, they've got something that covers them for an eye exam. Luckily in Charleston, we have some things, vision screenings pop up in schools from time to time. There's also a mobile unit that brings an optometrist to those schools that are in areas that are in more need, where kids are less likely to have access to eye care. But that usually is just the first step, making sure that we're maintaining that year over year. We have a relationship with a doctor of optometry that's checking our eyes every year is really part of it. But luckily in the Charleston area specifically, we should have enough doctors to cover the amount of patients. We just need to make sure patients know it's important to get your eyes checked every year.
Well, absolutely. Absolutely. Well, Dr. Jesse Willingham, thank you so much for your time. And again, welcome to Quintin's Close-Ups.
Thank you so much, and thanks for letting us spread our message about kind of what we do different.
Oh, you're welcome anytime.